When you have sharp, radiating pain shooting down your leg, simple daily tasks feel exhausting. But many men in their 30s to 50s are noticing a secondary, quieter struggle. Right as their lower back starts to crack under the weight of chronic irritation, their erection quality and libido suddenly drop. The connection here is entirely anatomical. The lower spinal nerves, specifically around the L5-S1 or sacral levels, are the same nerve pathways that govern both your lower body movement and your pelvic arousal signals. When those sacral roots are compressed, the constant low-level inflammation continuously drains your adrenal resources. It makes simple movements feel heavy and creates a psychological block that strips away your desire for physical spontaneity. The standard response is to reach for standard erectile dysfunction pills. Men assume the issue is poor blood flow, so they treat it strictly as a vascular problem. Treating a mechanical nerve compression with a vascular quick fix ignores the actual damage in your lower spine. The root problem remains entirely untouched, costing you money and further draining your physical confidence when the pills inevitably fall short. The same is true for heavily marketed candy-like nerve gummies. A proprietary blend of vitamins cannot physically unpinch a nerve or fix the structural compression happening in your lower back. Take a look at this flowchart. It maps out the biopsychosocial loop, showing exactly how physical pain and sexual dysfunction continuously reinforce one another in a downward spiral. Let's follow the physiological path first. Chronic sciatica pain disrupts your deep sleep. That poor sleep impairs your testosterone production and heavily restricts the nitric oxide pathways required to maintain an erection. Now look at the psychosocial path. The stigma of managing pain in secret reshapes how you see yourself. It creates severe psychological stress that acts as a roadblock, worsening your intimacy issues and keeping your body in a highly tense, inflamed state. Breaking this specific loop requires a two-part approach. You need specific mechanical movement protocols to physically decompress the spine, combined with clinically dosed nutraceuticals to support the nerve tissue. You have to treat your whole system, your nerve health, your metabolic balance, and your social identity. Slapping a Band-Aid on a single symptom simply will not work. The absolute non-negotiable foundation of this recovery is mechanical decompression. Without physical rehab, no supplement on the market is going to move the needle. The physical input required is straightforward, but demands consistency. 20 to 30 minutes of daily walking, paired with targeted pelvic and simple glute activation stretches. This daily movement physically reduces the compression on the L4, L5, and L5-S1 discs. Relieving that direct squeeze on the sciatic nerve pathway is the only way your nerves can actually begin regeneration. The main trade-off here is patience. Depending on the severity of the compression, full nerve repair takes anywhere from 3 to 6 months of consistent effort. While you manage the physical work, you have to address the psychosocial input. You need to clearly communicate your physical limitations to your partner without shame, removing the performance pressure from intimacy. Qualitative research on chronic pain highlights how deeply the condition fractures a person's social identity. Participants report deep internal stigma and a sense of letting others down. Having these conversations is uncomfortable, but holding pain in secret only amplifies your body's stress response. Mastering this dual foundation, pushing through the physical discomfort of rehab while navigating the vulnerability of communication, lowers your baseline stress. That drop in stress is a strict biological requirement for your libido to return. Once the physical foundation is in place, we can introduce alpha-lipoic acid, or ALA. This is the most effective biochemical intervention available for nerve repair. You need pure, third-party tested capsules. The required dose is exactly 600 milligrams daily, split into multiple doses to avoid nausea. ALA successfully crosses the blood-nerve barrier. It acts as an antioxidant, reducing oxidative stress and physically supporting myelin repair around the compressed nerves. Avoid the marketing hype surrounding gummy formats. They frequently contain high amounts of sugar alcohols that cause severe bloating and slow down the actual absorption of the active ingredients. The major trade-off is that ALA cannot shrink a herniated disc on its own. If you are not pairing this dose with daily mechanical decompression, the supplement is largely ineffective. Supplements are biological adjuncts. They only yield a return on your investment when they are layered on top of consistent physical rehab. The secondary layer of intervention supports localized circulation and energy. For this, we look to L-citrulline and acetyl L-carnitine. The precise input is 3 to 6 grams of L-citrulline and 1 to 2 grams of acetyl L-carnitine daily. Powders stirred into water generally work best for consistency and optimal absorption at these amounts. This combination serves a dual purpose. L-citrulline efficiently boosts nitric oxide production for pelvic blood flow, while acetyl L-carnitine provides direct mitochondrial energy to the nerve cells. When combined with alpha-lipoic acid, these compounds have a well-documented synergistic effect. In tracked trials, patients report measurable drops in pain scores and noticeably firmer morning wood compared to using either supplement alone. This comparison matrix evaluates our 3 tiers of intervention: doses, target mechanisms, and timelines. Executing this full protocol requires trade-offs. Your daily habit friction increases, the timeline extends 3 to 6 months, and supplements cost $25 to $40 monthly. Skipping these steps or relying on cheap, proprietary blends simply wastes your money. Real physical and sexual recovery demands a deliberate, targeted investment of both time and capital. If you work a desk job or carry extra weight that increases disc pressure, we can map out a highly actionable 14-day baseline protocol to get you started. This decision tree maps out a straightforward path for your next 2 weeks, starting with a vital medical checkpoint at step 1. If you experience saddle area numbness, changes in your bladder control, or progressive leg weakness, stop self-treatment entirely. Seek immediate medical imaging, as these are signs of Cauda equina syndrome. If you are medically cleared, start the foundational 2 weeks. Commit strictly to 20 minutes of walking and 600 milligrams of pure ALA daily. At the end of 14 days, evaluate your pain reduction before adding any circulation boosters. Pacing is critical. Properly evaluating how your body responds after 14 days prevents wasted effort and ensures you aren't further aggravating your irritated sacral roots. Erectile dysfunction tied to sciatica is a complex issue. It requires a comprehensive structural and psychosocial solution, not a localized vascular pill. You have to completely abandon the illusion of overnight fixes. True recovery means accepting a multidisciplinary, slow-burn protocol. The chronic pain and the resulting loss of your social identity are heavy burdens to carry. The emotional labor required to communicate that vulnerability is significant, but it is entirely manageable when you use the right framework. Start simple today. Pick one active ingredient, have a clear, honest conversation with your partner, and begin your daily, deliberate movement. Reclaiming your sexual health from chronic pain is ultimately an act of reclaiming your broader physical and social identity. It requires patience and strict adherence, but it is unequivocally worth the work.